We just wrapped up May, which was National Stroke Month. Each year, nearly 800,000 people in the United States have a stroke, according to the CDC. Dr. Ralph Gonzalez is a neurologist at Manatee Memorial Hospital. He's here to tell us what we need to know about strokes. Thank you for coming in.
Thank you for having me.
Since you're the doctor and we are not, help us understand physically in our body, what happens when someone has a stroke of any severity?
Well, the most common type of stroke is what's called an ischemic stroke. And that is about 85% of all strokes are ischemic strokes. And that is when a blood vessel in the brain of varying sizes, large or small, becomes blocked for any of a number of reasons. And when that happens, the area that blood vessel serves stops functioning. And if it resolves quickly without any deficits, that's what we call a transient ischemic attack. If, however, it persists and there's actually damage to the brain, that's when we call that an ischemic stroke.
Okay, so obviously because this is happening in our brain, it's pretty hard to tell that it's about to happen.
Correct.
What symptoms does our body show when any type of stroke is occurring?
Well, there can be quite variable, but the most common things that are associated with stroke, we look at an acronym called BFAST, okay? So the B stands for balance, the E stands for eyes, F stands for face, A stands for arms, S stands for speech, and T is in reference to time, because time is of the essence when it comes to stroke treatment.
Okay, so if any of the BFASTs are occurring,
correct,
does it need to be just one, just two, or is this a case of better safe than sorry, do something?
Exactly, better safe than sorry. If one of them occurs, if you're having some new onset of something, and for instance, your balance all of a sudden becomes very impaired, or you can't see on one side or out of one eye, or all of a sudden you can't speak, yes, those things need to be evaluated emergently. In a stroke center, and Manatee and Sarasota County have multiple stroke centers. There's every hospital in the area is either a primary stroke center or comprehensive stroke center. So the best way is to get to one of those stroke centers via EMS. That is the most important thing that I can express to people, is to call 911. Okay.
Not your friend, don't get a ride.
No.
Go with a professional. No. Why is that and the time element of this so important?
Well, we say in stroke neurology that time is brain. Okay, so you do lose on average about 1.9 million neurons a minute, okay, when you're having a stroke. And when you call 911, that will pre-alert the hospitals that are on there, you're being taken to.
Got it.
So they will clear the CAT scanner. They will have the stroke team meet you at the door. They will prep things that will potentially start the treatment process of stroke, as opposed to you driving in and then you may or may not say the right things at the waiting room and you may sit there for a while. Whereas if you come in via EMS, you'll be immediately taken to the front of the line. I
think that's a really important takeaway, because honestly, especially since the symptoms can present themselves subtly, people would be hesitant to call EMS, right? You'd feel silly, this isn't really an emergency, but any threat of a stroke, any even inkling, becomes an emergency.
Yeah, as I tell patients that tell me that exact thing in the emergency room, I'd rather have you here and everything be okay than have you at home and have something be an actual stroke.
Right. No, that makes a lot of sense, and I think is something that we really can take away. Once a stroke occurs or is occurring, can it be stopped? And from a neurology point of view, what can you do?
Well, the short answer is yes. Okay, it can be stopped if you get to the hospital quickly enough and within the time windows. And that depends on the etiology or the cause of the stroke, and things that we can identify as a causative factor, such as a clot in a particularly large vessel or a small vessel. We can give IV medications or clot busting drugs. And if those are either not appropriate or not effective, we also have the ability in comprehensive stroke centers to do mechanical thrombectomies, which is where, just like they do with heart attacks, is they can go up with catheters into the brain and take out the clots mechanically. So
it doesn't necessarily mean you're going to have a massive problem the rest of your life because you're having stroke symptoms. If you get to care, the technology and certainly your expertise is allowing for help.
The likelihood of you having a good outcome goes up significantly if you get to the hospital sooner rather than later.
All right, well, certainly time and the essence of time is the big takeaway here. And remember, be fast. Those are definitely the symptoms, no matter how minor they seem, that we all want to take seriously when this happens.
Absolutely, absolutely. If it turns out to be nothing, that's fine, but we'd rather sort it out in the emergency department, the stroke center, than not be able to do it, anything after the fact.
Absolutely, and that's what Manatee Memorial Hospital is all about, being there for any of your needs. For more information on stroke care, any health concerns, you can find the team by going to manateememorial.com. We'll be right back.